Good evening and welcome to Releve Sports Medicine's Virtual Journal Club. For additional webinar educational opportunities, you can visit our website and register directly for the webinar, or you can sign up for the email list to be notified of upcoming webinars. We are updating our schedule frequently, so check back often. For all athletic trainers who are intending to get live CEUs from the BOC, you'll receive an email 1 hour after the webinar concludes, which includes a link to the combined quiz evaluation and assessment. You will have up to 72 hours to complete the quiz and the evaluation. This email will come from customer care at gotowebinar.com. Please ensure that this is done timely so that we can make sure that you receive your statement of credit. If you don't receive the follow-up email or you'd have any other questions or concerns, then contact us via our email at journalclub@relevesportsmedicine.com. Once this statement of credit is available for download from our website, you will receive an email notification. If you have any questions during the webinar, please submit the question and we will review questions at the conclusion of the presentation. If you cannot see the PowerPoint slides and you're accessing the webinar from your mobile phone, swipe the screen to the left or to the right and the slides will become visible. There is a handout which includes the slides in PDF format and an article related to today's talk, which is available for download from the dashboard. The recording will be available on our website and a link will be included in the follow-up email. Our speaker this evening is Dr. Michelle Joy, who is a psychiatrist at the Philadelphia VA Medical Center. She completed her undergraduate degree at Brown University, medical school at Yale School of Medicine, and a residency and fellowship at the Hospital of the University of Pennsylvania in Philadelphia. One of her many experiences within publications and research is that she worked with Dr. Jody Foster to publish a book entitled The Schmuck in My Office, How to Deal Effectively with Difficult People at Work. She's presenting on mindful performance.
All right, are we ready to go then?
Yes, we are.
Okay, great. Hi, everyone. Hopefully the technology will work. You can let other Michelle know if there's any problems with that, and I'll try to fix it quickly. So today I am going to be talking about mindful performance. I was trying to figure out a good topic that would cross over with the athletic training and other kind of athletic community and people interested in sports and athleticism with my background as a psychiatrist. So this is what I came up with. I'm not particularly athletic, but I am trying to be mindful. So I'll talk a little bit about what we are going to aim for first. Let me make sure. Okay. So for our objectives for the presentation, first, I'm going to start by describing just pretty much what is mindfulness, the basis of this concept from a couple of different perspectives. I'm going to list some of the benefits of mindfulness. This will be a lot of background information. Some of you might be familiar with it, some of you not. And I promise it will get to the part that is relevant for athleticism and performance. I'll also talk a little bit about anxiety and anxiety disorders, particularly because mindfulness is helpful for general anxiety in the overall population, as well as people that suffer from problematic anxiety. And then lastly, I'm going to be talking specifically about mindfulness and its applications for athletes, why it's beneficial for athletic performance, and kind of how you can learn about it, benefit from it, and practice it both for your own performance or for those that you might work with. Okay. I have no relevant financial relationships to disclose. Okay. And so a little bit I gave the outline, but this is kind of the order that we'll go in, starting with a little bit of a self-assessment, general basis of mindfulness. I'm going to focus a lot on mindfulness in the breath, and then go into athletics and finally anxiety. So John Kabat-Zinn is probably one of the most well-known speakers and thinkers and writers in the mindfulness field, the field of mindfulness. He's actually a PhD. I first came across his work maybe I took some mindfulness classes, neuroscience of the brain classes in undergraduate, but I also learned a little bit about therapeutic mindfulness as a psychiatrist. So one of the basic texts that we would always refer to is by Jon Kabat-Zinn, and this is the phrase that people refer to again and again as the framing concept for what mindfulness is. And that phrase is, mindfulness is awareness that arises through paying attention on purpose in the present moment and non-judgmentally. It seems pretty simple, but I'm just going to break it apart for a minute. So first of all, mindfulness is an awareness, and it comes through really focusing with intent on the present, not anything in the past or the future, and to focus on that experience, whatever that experience is, non-judgmentally, to accept it for what it is, to not fight against it, and to not have resistance toward that experience. So I'm just going to read it one more time because it really is kind of beautiful when you come back to it, understanding what mindfulness is. So it's the awareness that rises through paying attention on purpose in the present moment, non-judgmentally. Okay, next slide. So usually we don't start with a quiz, but in this case we will. We're just going to take a couple of minutes, and it's not a pre-test quiz, it's really a self-assessment of some mindfulness concepts. So this first slide gives a little bit of the background of what this quiz is going to be, and it is a day-to-day experiences assessment. So this, as you answer these questions, as I go through the next couple of slides, over several moments, you'll see a collection of statements about experiences in your life day to day. So using a 1 to 6 scale, and at the top of each slide, it'll essentially have what that scale represents as such. Jot down, if you have a piece of paper, or keep mental score of how infrequently or frequently you have each experience. And as you're going through it, please try to answer the question and mark down the score according to what really reflects your experience rather than what you think your experience should be. So, you know, this isn't for any sort of credit, and it's really for self-reflection, and score them, like I said, keep a cumulative score if you can. So I'll give us a couple of moments. I'm not going to read through them just because it's probably easier for you to read through them yourself. So I'll just give us a couple of minutes for this first slide. Take your time, and I'll give us like 2.5 minutes. Thirty more seconds. Okay, and now I'm going to go to the next slide. So this is just the second half that I had to break up. So continue the same process, and I'll give you another couple minutes. Give everyone 30 more seconds for this slide. Okay, so to calculate your score, just take, it was a 15 question assessment, so you can just get an average of that if you want. And I'm just, while you do that, I'm remarking and thinking about the fact that while I had that pause, I was really aware of my own kind of bodily sensations and kind of judging myself. Is this too much time? Is this too little time? And trying to be mindful of the experience itself. And I also wonder how many people in the audience were kind of rushing through it or doing other things, you know, while listening to this presentation. So I think it's always interesting to reflect on how mindful we're being while we're talking about it too. Okay, so in terms of scoring, and again, this is just a little bit background information. This is some normative information that the scales producers made. So for different samples of, you know, hundreds and thousands of people, for community adults, that MAAS is the score, had 4.2, college students had 3.8, and again, that's just kind of not to show you anything that community adults are different than college students, more just to give you a sense of what some different normative scales have shown for this. With some background information, though, is that there have been lots of other studies about this scale, which is called the Mindful Attention Awareness Scale. And Zen practitioners have done a lot better on it. And there has been data showing that kind of the more you practice mindfulness, the quote unquote better, even though we try not to be judgmental, your score will be on this. So this is a little bit about this scale. As I said, it's the Mindful Attention Awareness Scale. And it really talks about a trait. So we're not talking about something that is happening in the moment. This is really about a trait or characteristics of people and perhaps of yourself if you feel like it was well reflective. Really what that refers to is one's ability to be aware of the present. So going back to that initial quote by John Kabat-Zinn, talking about awareness, that's paying attention on purpose in the moment and non-judgmentally, this scale represents a little bit of how much someone has a tendency to be able to be aware of the present. And so when you take an average of the items on that scale, a higher score is not just associated with mindfulness, which would kind of be tautological for this scale in of itself, but it's predictive of overall well-being and one's really ability to regulate their emotions and behaviors. And it's also been shown predictive in multiple samples to show the strength of social relationships and a number of other factors. So what the Mindfulness Attention Awareness Scale is really showing is how someone can simply observe what's taking place. And this really contrasts to our conceptual processing mode in which we're overthinking things, where everything in our present or past or future is really being filtered through, you know, evaluations, judgments, memories, beliefs, and other kind of things. This is a receptive state of being, and that's really key for mindfulness, is it's observational and receptive. And so it's a little bit of background just so you can kind of see how your own score was. Now let's see if I can get this little guy to work quickly. Oops. Okay. See. Oh no. Might not be able to hear that. Hold on one second. Okay. All right. I'm not sure if it's able to be heard, but if not, it's a cute presentation. Basically, it's talking a little bit about what mindfulness is, and we can skip that slide because I'm not great at technology, but it's the only video, so we can just skip that. So essentially, just a little bit more background information about what mindfulness is. We've already talked about being attentive and accepting of experiences. It's an there it says active, whereas before I said passive. It's a passive state, but it's with intent. So that's what the term active means there. And mindfulness is really it's observing all of the things in the present state, and that includes everything going on with ourselves in the way that our own self processes information. So that's physical experiences, mental experiences, and emotional experiences. And it's a continual return to the present. So some people say, I can't meditate or I can't be mindful, my mind wanders. There's really not supposed to be any judgment in mindfulness or meditation, and there's no real can't, because it's a practice. So every time, the practice of mindfulness is that every time your mind strays from focusing on the present, you bring it back. So in mindfulness practice, they call it monkey mind. Your kind of mind's swinging from branch to branch, tree to tree. And so people will be judgmental of that fact and say, I can't practice mindfulness. But in fact, the very essence of mindfulness is to notice the mind jumping around and noticing all of these different things and bringing it back to the present. So that's what we term the continual return. And it's really not just being aware of these things, but accepting them. There are different ways to conceptualize mindfulness as the term itself. We've described it a bit, but it can refer to a way of being. So you can be in a mindful state. You can, be in a particularly mindful phase or time. It's a capacity, kind of as so that scale that we did at the beginning. It can be a practice. Both you practice mindfulness as a verb, and you also it is a practice. I refer to as a physician. Physicians practice their art or their science. It's not something that's achieved. Just as musicians practice, there's even proficiency. You're not trying to attain a state and then stop. And so, maybe in popular culture, people think of mindfulness and achieving enlightenment, but it's really about a continual practice. Okay. So the psychology is rooted really in Buddhist practices, but you don't have to have a particular religious or spiritual affiliation. But if you're unaware, Buddhism is really kind of a religion and a philosophy focused on the philosophy of suffering. It seems contradictory, but it's what we call a dialectic, in that it's focused on the relief of suffering, but also the simultaneous acceptance. And in that is the fact that the more you push against something, the more you fight against it, the more you try and push it away, such as suffering, the more it is actually present. So we think about that with pain. The more you fight against pain, the more it's there. The more you fight against the anxiety, the more it's there. And so Buddhist philosophy says that a lot of suffering comes from this craving or desire to get rid of pain rather than acceptance. And with acceptance actually comes this almost contradictory relief from it. And so the psychology of this is to change your relationship with your thoughts and emotion, like I said, to acceptance, to identifying less with them as problematic, to not judging them, and really not trying to avoid them. And through this way, if we think of ourselves and each of our own individual selves as being composed of, emotions and thoughts and feelings, if we are changing our relationship with them, we can kind of change our identity. And in a bit, we're kind of learning to watch the mind as it goes through these different reflections. So what is mindfulness good for? Like I said, we'll start a little bit more general and then go into the athletic parts, but really a lot of things. Going through the literature as you'll read, there's just so many benefits. Too many probably to go into all the specifics because there's really so much literature, and I can give some resources for looking that up. But physical benefits, mental benefits, physical benefits like immune boosting, lowering blood pressure has been well established. There's evidence of curbing addiction, craving, reducing mood lability and emotional reactivity, meaning not really kind of reacting as intensely to things, not being as upset. Organizational well-being in the sense that, you know, even for an employment team, workplace, you know, increasing resilience, decreasing stress. Cognitive benefits include increasing focus, improving memory, social benefits. There's good effects. There are good effects on empathy and altruism. And so really why mindfulness, it almost sounds kind of fake that it's helpful for so many things, but that's because it's really not, it's not a specific technique, but because it comes from this religious and philosophical background, it really applies more to a mode of being. And by achieving a mode of being or practicing a mode of being, you have all kinds of interconnected benefits. And so the basis of mindfulness is really a focus on the breath. And so in all of this, no matter whether we're doing a mind-body practice, the parts of this that will focus on athleticism, it really is about the breath. And before I refer to a continual return to the present, and through mindfulness, we usually anchor through the breath because we consider that the breath is always with us, right? It's one of those states, it's one of the things that we can notice pretty much in our awareness more than any of our other bodily functions for the most part, maybe our heartbeat, but it's always there with us and relatively accessible to our awareness. So it has a very important role in meditation and mindfulness. And so I just wanted to do a brief breath exercise. I won't do the YouTube video since people would unlikely be able to hear it. But if you kind of just want to take a minute and put yourself in a comfortable position, particularly if you are sitting on a chair, try to sit up straight, put your feet on the floor. You want your back straight, the crown of your head toward the ceiling, maybe as if your head is being held up by a string. You don't have to be overly active or tense in your back muscles, but kind of settle into a state of relaxed attentiveness. Notice your feet on the floor. And then you want to begin just by noticing the breath. Notice the breath the way it is. You might want to be curious about the breath. Perhaps as a newborn child is curious, animals are curious, there's almost a playfulness. Noticing your breath might be something you haven't done in a while. What are the qualities of the breath? Try placing one hand on your belly and another on your chest, maybe over your heart. Still noticing the breath as it's there with you. You want to notice the movement of the breath. And as your breath moves, it should be moving your hands. As you inhale, the breath will lift the bottom hands. It will rise through the torso. And you exhale, the chest will release and the breath will flow out so that your hands also move. Stay with the breath. If your mind wanders, you can just return to it. The flow of the breath through your body can be like water pouring from a glass. The breath can fill the torso, gradually widening, contracting. And just continue that for another couple breaths. Okay, so that's kind of a basic breath exercise. You can come back to the room, open your eyes if your eyes were closed, and just take a second to notice if you feel any different. You might feel more relaxed, but you might not. You might feel anxious thinking about your body, being asked to do something you might not have done before. You might have a sense of comfort coming back to a familiar exercise. I just wanted to familiarize kind of everyone with a basic breath exercise in that way. And that's similar to a foundation of many, many exercises in mindfulness. We're always going to begin with the breath. And to get a little bit to the physiology of this, think of the breath, we refer to it as the respiratory gait. There's really a long history of involving the breath in athleticism and performance, from warrior chanting to warriors in different cultures would chant to focus on the mind, to concentrate, to have endurance for pain. I also think of different cultures chanting, singing, through ritual and being able to focus on the task at hand. A lot of people think of the Om practice, which is with the breath-based. So medicine-based, why we're here, right, is that, like I said, the breath is always with us and it's accessible to us. So the breath is really the only bodily function that we can easily control voluntarily. So of course, you know, you can maybe have to use the restroom, hold it in, you can use the restroom, but at any moment you can't necessarily voluntarily control those functions. You can have some degree of control over your heart rate, but a lot of those actually, when you're accessing them, it's through the breath. So if your heart rate's speeding up, it might be through variation of your breath. Even as you're bearing down to use the restroom, a lot of time it's from holding your breath. So we think about the breath as a gateway to the rest of the body and to the mind itself. So most breath practices are going to focus on slowing the breath and really changing the ratio between the exhalation and the inhalation. So you might have heard someone say to you, you know, just breathe when you're upset. And it actually makes you more upset because you're like, I'm breathing, and trying to breathe and catching air and just making things worse. But it's really about slowing down the breath and increasing the exhale ratio. So those of you that might have a background in neuroscience or any kind of brain medicine, because there's different parts of the brain that are controlling different areas. So the amygdala is well known for emotional reactivity. And so the breath with which we have conscious access can actually access different states of the amygdala. It can change our prefrontal cortex, which is how we control impulsivity and decision making. It modulates the hypothalamic pituitary axis in terms of hormones and neurotransmitter control. GABA is one of the main neurotransmitters that we have that induces a state of relaxation, and the breath can directly access that. And oxytocin is a neurotransmitter, particularly there in nursing after birth and after intercourse, and has a relaxing sensation, and the breath can also access stimulation of that. The breath slows heart rate, it can calm the digestive tract. So for all of this, the breath is accessing our autonomic nervous system. And that's why we start with the breath and end with the breath and are always there with the breath as it's there with us. That's kind of the biological basis for it. You know, you think of fight or flight and the autonomic nervous system, sympathetic and parasympathetic. We're really using the breath as a pathway to our vagal nerve stimulation and that communication highway between our brain and our viscera. But it's not just the breath. Mindfulness is a mind-body practice. So we, you know, everyone thinks of yoga, which is the term comes from a word meaning unite, and so it's really the uniting of the mind with the body. There's meditation, which is more mind-based than breathing focused, but they can be combined. There's sitting meditation, similar to the one we just did, sometimes on a pillow, which is a more formal meditation. There's walking meditations. You might just go for a walk, noticing your feet on the ground, really being present in the way that we were with the breath, but focusing on, sensations outside, wherever you are. And those of you that might have a little bit of difficulty, especially starting with a breath-based sitting meditation, it might be easier to go out for a walk and practice in steps. Body scans are another type of mind-body practice where you use your attention like a flashlight and focus in on different parts of your bodies to receive information from it. And then mindfulness can be really, really integrated into everyday activities, simple activities. Mindful eating, we do a practice, just eating one raisin and really focusing on that, on the experience of eating the raisin rather than, gobbling down a whole bucket of ice cream. Mindful sweeping, mindful cleaning, mindful dishes, mindful brushing of your teeth. So it's really applicable to anything. And, these are still practices, so you can make them more or less formal. It's really about practicing them. So in general, I talked about some of the benefits on the body and mind, but kind of transitioning now into performance, because meditation mindfulness is an attentional practice, the performance benefits are going to be able to focus attention on performance, on the task at hand, whether on athletics. Because it's non-judgmental, we really learn through the practice about using our personal strengths without overusing them. The practice really focuses us to push us to our edges without, burning out, which I think is important for sports and athleticism, knowing, to push yourself really hard when to do that, but also not to hurt yourself in the process. A lot of athletes and musicians, speakers talk about flow states. People might have heard of that, where you're so focused in the moment to the exclusion of everything else. A lot of high performance athletes talk about accessing flow states, which can be done through the development of better focus and concentration through mindfulness. We become more in tune with mistakes and non-judgmentally what we might have perceived as failures, but learning from them, because when we learn in a non-judgmental way, we're better able to apply the information that we've gained. And kind of in the same way, really committing to doing well. Being non-judgmental doesn't mean that you can't have goals or that you can't strive. You can still seek to do something, but to not put it above all else. So being an excellent athlete, but not a perfect athlete. And with that kind of seeking comes actually a better ability to achieve those goals. So how this can apply to high performance athletes, and I'll talk a bit about high performance athletes because a lot of the studies are done with them. Obviously, it's really interesting to learn how high performance athletes function, so that we can try to mimic those states, teach those states, and learn the benefits of those states even for people outside of athletics. So what we're talking about with high performance athletes are those in really high intensity competitions. And one of the things that high performance athletes are able to do are really proactively assess a situation, whether that's in a game, whether that's their body, in a run. They're able to judge what's happening to their body or out on the field almost a step ahead, right? Some of you probably are aware of that focus and to anticipate what the other team is doing, what the ball is doing. But the high performance athletes can almost do that a step ahead. To my mind comes, movies with the bullet really slowing down, or, the soccer ball slowing, and that's kind of the intense spotlight, searchlight focus is able to really break down time in that way by focusing so intensely on the present. So high performance athletes are able to do that, whether or not they practice mindfulness. And so we begin to see this natural fit between mindfulness and and performance, whereas other athletes might, be responding to things as they happen, maybe a little bit of anticipation, but much more reactive. High performance athletes, in the same way that I said, anticipate stuff out in the world, in the fields, in the pool. They're also able to understand their body signals better, to receive information better about their bodies, and to be able to make micro adjustments to achieve whatever goals they want. So that would both be to anticipate errors in their body and to redirect into more kind of efficient modes and steps. So as I said before, we think of practice and mindfulness. I brought up, practice in medicine, the practice of medicine, practicing an instrument, but here we are, in a sports medicine place. So not only does practice refer to medicine, but also to sports, of course, right? That's probably where most people are familiar with the term. So we practice in sports to be able to do well during these high intensity competitions or any competition, right? And I put that at the top there to say practice is practice is practice. And so all of you that are interested in sports, do well in sports, are able to do that, kind of trying to adapt that mode of thinking also to mindfulness will kind of create this circular feedback loop, because practicing one can be practicing the other. And just like in athleticism, you're going to have this training regimen. You have different phases of training. You also, you have game day prep, you have the game, and you're getting yourself ready both mentally, emotionally. It looks like I left off physically, but you're preparing all of these things through practice. And I as a psychiatrist working in mental health, and I know the same would apply to athleticism, is people say, well, I tried this skill, I was really upset, I tried this skill, and it just wouldn't work. Well, of course, you're not going to send someone out into, a championship game without practicing drills first. And so even for the emotional benefits of mindfulness outside of sports, it's about practicing in the downtime, whether, for surfing, sitting there, having the board in the room that you're just practicing on in the house, not even out on the water, just dribbling a basketball while you're sitting, almost like, I guess that would be non-intensively, but really low-key repetitive practice to prepare for being able to use it in high intensity situations. And that's kind of the background there of the comparison. So it's a little bit what we said, mindfulness for athletes. It's a way to connect our thoughts and feelings and behaviors for performance, for stress adaptation, and the processing of our bodily signals. And what I really want to focus on is that communication between all of it. So we talked about the physiological communication, but for an athlete, you really have this idea that through mindfulness and in general through practicing sports, you want to be able to receive information from the body, from the field, also cognitively from role models, from coaches, and to be able to put that all together. And mindfulness is really a way to do that, to do it in a cohesive manner, and to do it in times of stress. There are, like I said, mindfulness can apply for so many people and places and things and benefits. But when you adapt some of the mindfulness practices specifically to sports, I guess this doesn't even have to say why for athletes, but what type of mindfulness, they can all cross apply. But really the kind of mindfulness or the things that would be most beneficial for an athlete to focus on in terms of mindfulness practice would be concentration, addressing perfectionism, teaching, to have self-compassion, to not judge the self, to not beat oneself up. And then really this kind of mind-body connection and being able to control, have strategy. There's a lot of data that runners, actually successful runners, have really mindful practices, whether or not they call it that, whether they know about mindfulness, or whether they even kind of actively do anything to prepare that. And that's, we think of runners, long distance runners, endurance runners, kind of getting into this mind space of discomfort, preparing for it, being able to work through it, but also knowing their limits, hopefully at times. So there's data, there's a lot of good data for athletes. So, right, of course, everything I said is, oh, it's great for this, it's good for this, it's good for the general population, it's good for health, it's good for well-being. But there's specific well-done studies that, you know, I have references to at the end, which I'll have in the PowerPoint presentation. But really, even from fMRI, brain scans, tons of data showing even just breathing practices on a short-term scale show optimized brain activity patterns for sports. It shows better impulse control, so not reacting, you know, in a way that's not productive during an athletic competition. And again, this is, I'm not going through the data just because there's so much of it, but this isn't the general sense of, you know, this is good for impulse control. There's very good data that these practices specifically have results, quantifiable results in these areas for athletes. Again, the data is there for increased awareness of bodily sensation. Athletes self-report that after doing mindfulness and breath studies that they feel more focused on the present. So that's a self-report. They're able to engage better into competitions, so not thinking about someone in the stands, not thinking, you know, about what has to happen later, not thinking about what happened last game, but able to focus on the competition or practice itself. Less negative self-talk is self-reported as well. And, you know, a specific study was even showing if athletes have, you know, sudden oxygen deprivation, as might happen through any phase of, you know, intense athletic exertion. But when that's simulated in a laboratory setting, those that have practiced mindfulness or even have done a small amount of breathing exercises have improved cognition in these kind of studies than people that haven't practiced mindfulness. And then there's good data showing resilience in the military and Marines specifically. So that's a little bit about the data there for athletes. I'm going to take a quick transition to anxiety. I don't want to run out of time, but I'm just going to give you guys a little bit of background information about anxiety, and so that I can talk about specific anxiety in athletes. And the reason that I'm bringing in this part of the talk as well is because anxiety, you know, exists in the general population. Athletes are people, so we would expect that to be similar, but also sports have their own kind of, you know, unique features of anxiety, types of anxiety, and things that contribute to anxiety. So anxiety in general is just anticipation, worry. This can be really normal, right? We don't want to say that someone who is having a loved one ill, we don't want to say that's pathological to be worried, because in fact it's quite normal, and that's a good thing to be worried. If someone's coming after us, it's good to have anxiety because it's self-protective. It's good actually for athletics to a small amount. There's a curve essentially that shows, you know, with an increasing, it's the performance anxiety curve, that with increased amounts of anxiety is actually helpful, but then when you get too much anxiety, it worsens performance for athletes or other, you know, performance tasks. So when it's an anxiety disorder, that's excessive fear or anxiety that overshoots the benefit on that curve. It's the most common category of mental disorder, with about 30% of adults having an anxiety disorder at some point in their lives. Just briefly, we don't have to go through, you know, all of the criteria, but generalized anxiety is really this excessive worry about everything, everyday things, you know, not the spouse being sick, but, you know, bills to an excessive amount. The worries are in excess to what the stress actually is. You get muscle tension, sleep complaints, you know, other cognitive problems. And there's more specific kinds of anxiety. There's social anxiety disorder, which is really physical for a lot of people. It's concern about social situations. People are worried about being embarrassed or humiliated. They don't want to be rejected or looked down upon. And this is a particular one that would come up in athletes because being embarrassed on the field, maybe they actually do really well in practice, but in front of an audience, they get, you know, what's called stage fright for other performers. So they might have end up avoiding situations, dropping out of something that they really love in order to avoid this. Panic disorder it's not just an anxiety attack, it's a specific physical kind of anxiety attack where you have a mental component as well. In fact, the physical symptoms are so severe, as listed on the right. There's all kinds of symptoms, but the symptoms are so severe that most people, first time and even later on, might perceive that they're having a heart attack, that they're dying, or that they're completely losing their sanity and will never regain it. So a lot of people will call 911 or actually go to the emergency room. And when it becomes panic disorder, that's when someone has a fear of having a panic attack again. So they might have these isolated panic attack episodes, but they also have this fear of having recurrent episodes that is a problem for their lives. Agoraphobia, people have probably heard of that, just about going out in public, but it's a little bit more general than that, is that it's fear of being without escape. So it's out in public, but it's not social anxiety disorder. It can be, you know, open spaces, crowds, things like that, but it's not about the kind of judgment that social phobia has. And then social phobia, right, we all kind of know about those snakes, spiders, but they can be really debilitating, depending on the phobia and whether someone has to encounter them in their daily lives. So anxiety disorders in general have different kinds of treatment, usually falling into the class of the conventional therapies, which would be psychotherapy. People know it as talk therapy. You know, once weekly in individual and group. CBT is a particular type of therapy that focuses, again, on that mind, feeling, body connection, and kind of working through automatic thoughts. Now more and more psychotherapies are involving mindfulness, components of mindfulness, but these are the more conventional treatments. There are medications. For most people, medications are a relief, not a cure. You know, a lot of medicine, probably outside of sports medicine, but even within sports medicine, there aren't cures. There's relief. You know, unless there's a broken bone, a lot of things in medicine don't have a cure, and it's about managing it and getting relief. And kind of contradictorily, the medications for anxiety disorders are usually antidepressants, which take, you know, 2, 4, 6 weeks to build up in the system. We don't like to prescribe too many anti-anxiety medications because they tend to be addictive and actually can worsen anxiety, but we won't get into the specifics of that, just for your awareness. Okay. And so with that backdrop about anxiety, just thinking about athletes now and mental wellness. So to have, you know, to understand a mental disorder, we want to understand mental wellness first. So so for athletes, knowing what is that mental wellness, what not for performance necessarily, specifically about performance, but what is mental wellness, well-being, even outside of the performance arena that would impact performance. So mental wellness for athletes, some of those psychological factors, when they've looked at high-performance elite athletes, are one's ability to control their emotions, both what they feel and how they portray their emotions, to keep themselves motivated, to be confident, right? To be able to adapt to situations, cope with stressors. And, you know, a part of mental wellness is really having supportive relationships. Okay, so this is kind of the backdrop of mental wellness. So anxiety in athletes, where do we stand with that? For the most part, the rates seem to be about the same as for the general population. So I know I said 30% of lifetime overall, but it was actually, you know, this is the prevalence at any given time. It's about similar prevalence and similar severity in athletes in the general population. It's also associated with depression. Some studies show a lower risk of anxiety disorders in athletes, but most actually show about the same amount. Risk factors for athletes of having an anxiety disorder would be female gender, self-identification, being of a younger age, or having recent adversity in or out of the athletic arena. why might athletes, who are well performing, who practice, who are organized, have anxiety? First of all, anxiety is nothing to blame someone about. It can be, biological. It can be for many different reasons. But there's unique pressures, right? There's performance, you're under pressure, there's the public aspect of it. And these are, injury, fear of injury, having an injury. Anxiety in athletes is a lot of times during periods of career uncertainty, dissatisfaction with career, retirement. And really most of the data shows, so we talked about the mindfulness, about the anxiety curve with performance. And so anxiety, the literature for anxiety in athletes shows both negative effects once it gets to pathological anxiety on motivation and performance. So part of my reason for, picking this topic, overall mindfulness and anxiety, and their kind of, cohesion, was that it's really important that people begin to identify and intervene in anxiety for athletes. And that can be, any different types of people. You guys are learning about it. It can be athletes themselves, athletic trainers, coaches, sports medicine doctors, family members, just important education overall. In general, for athletes, treatment's underutilized. Mental health services for anxiety is, there's lack of awareness, like I said, which is why this educational piece is important. There's a stigma, so a lot of people are afraid, like in other careers, jobs, or even, in high school, other, levels of competition, that if they report anxiety, if they tell people that they're anxious, that they won't get a spot on the team, that they won't be put into the game day. And so there's, the general stigma that exists in the public against mental difficulties, but also, because sports are a performance field, maybe additional stigma about reporting. And then a lot of, sports are take place in the youth, and a lot of times those have higher rates of anxiety and lower rates of seeking treatment. And there aren't a lot of adapted treatments specific for athletes, which is why I'm interested in this intersection between mindfulness and treatment for anxiety in athletes, because there might be specific cultural factors, training schedules, medications might not be appropriate. Some types of medications might not be appropriate for whatever things the body has to do. So let's see, just kind of in relative sum, as we're getting to the end of the presentation, just thinking about mindfulness and its, really many components, and the way that those components interact both for general well-being for the population at large, thinking about mindfulness's ability to have positive effects on anxiety disorders in the population at large, and then really coming to think what I'm hoping to think about, and what I'm taking away from this is really thinking about developing some mindfulness-based interventions that are particular for anxiety in athletes. So there is a fair amount of data and training programs about mindfulness in athletes to encourage high performance, but I'm interested in really adapting some of those to treating anxiety as well in the athletic population. So that mind, body, self, all of this that comes, to play in mindfulness comes to play also in athletics. So the mind, we have anxiety, self-judgment, self-care is important. Just want to emphasize that. We have that, this is kind of the summary slides, right? So the body component, don't want to be pushing yourself through fatigue and through exhaustion causing injury. So part of mindfulness and its applicability to sports is being curious about the body, understanding bodily sensations, kind of learning limitations of the body and accepting those in a non-judgmental way. And then just in general life, right? We're all very busy, kind of run on autopilot. Some of you might have noticed that on your self-assessment scales, how much of life kind of happens automatically without the proverbial stop and smelling of the roses. People are focused on achievement, sleep deprived, and so mindfulness can, while it's helping with athletics, just help overall with our abilities to just achieve general well-being in our life. I will skip this, but I do have a poll if we're able to do that. I close poll. So basically, I wanted to see if you, any of the following, if you guys use any apps. And so some mindfulness apps, meditation apps are Headspace, Calm, 10% Happier, COVID Coach, and Insight Timer. So I just wanted to see if you guys use any of those apps. And hopefully I can figure out how to do the poll. Just take a minute. All right, so let's see if I can get this to work. Pause version.
What I'll do is at 1 minute, I will close the poll. Yep, and
perfect.
then
Thanks, Michelle.
Responses available. Do you want me to share those responses?
Yeah, to kind of see. Okay, interesting. So, so let me see here. It looks like I can't see the. It looks like most people, if they use anything, use Calm. That's the one I use every day. Headspace I use a little bit less. So I think you guys all, or at least the population seems exactly to follow the proportion that I use in myself. COVID Coach is actually developed by the VA where I work, but it can be used by non-veterans too. So I use Calm the most, and then Headspace 10% Happier, and then Insight Timer. So I think that's interesting. I just wanted to see a sense, and it sounds like some of you are already using, these apps. And so those of you that aren't, those might be recommendations for you. A lot of them are free for people in healthcare. If you're in healthcare, a lot of them have free trials, and some of them are also free just given the ongoing COVID pandemic. So I think we are, let's see, for the most part, okay. Am I off audience view? Okay, let me share it again. Just very briefly, I wanted to, since most people aren't, traveling much right now, or really going in and out of places, but for the future, there are two kind of mindfulness study centers, one's at the University of Miami and one's at University of Florida. So you can, in the current healthcare climate, visit the websites, but also check them out. At some point, I'm in Philadelphia, but I am from Florida. And then just time for questions if there are anyone that has them, and otherwise thanking everyone for being here. And Fralave for having me speak and share on kind of a really cool intersection that I found between, what I enjoy and what the rest of you do. So thank you.
Yeah, excellent. Excellent job. Excellent presentation. I know we're going to get lots of good feedback here. I've got one question here from Heidi that I think is going to be in a lot of people's minds right now. Do you have any suggestions for dealing with increased anxiety for athletes due to COVID, either fear of or canceling of the season or the sports, not being able to participate because they get sick? Do you have on that?
Yeah, for sure. So right, in general, I think coming from a place of acceptance, right? So being able to kind of accept, applying mindfulness principles, I think for this would be kind of accepting that we might not have control over some of these aspects, like whether, other than outside of political activism, if you have specific goals or motivation for this, but accepting the fact that that we don't have control over the outcome for the most part, the pandemic, other than what we wear ourselves. And so I think a lot of the practices in terms of patience, in terms of accepting ourselves, not wanting to rush back into things, not wanting to hurt ourselves, understanding that a little delay, might hold us back, quote unquote, in terms of perfectionism. But overall, the picture is one of self-care and compassion. And so I think all of these practices would apply, in just kind of framing the pandemic in these terms. I think it's a great question. And a lot of, like I said, a lot of the apps are free in this time period. And that is because it's so applicable to COVID anxiety.
Awesome.
Yeah.
Well, I appreciate that. And thanks for sharing those resources. It looks like for the people who responded, there's definitely a lot of people utilizing them, but being able to utilize those with our athletes will be helpful as well. So thank you so much for speaking today. Thank you everyone for coming, and we look forward to seeing you at a future webinar.
Awesome. Great. Have a great day, everyone. Take care.